Hi everyone, welcome to Medicine for Dummies. I'm Dr. V. Today we move on to the second topic in our medical disorder series. Note that this topic will come in 3 videos, so make sure to check out the other 2 videos later. Of course, don't forget to like, subscribe, and share, and comment below if you want any other topic covered. So, our topic today is a very common and deadly mosquito-borne illness seen in tropical and subtropical areas of the world. Dengue fever. Dengue is the most important arthropod-borne viral illness in the world. It is transmitted by 2 types of female mosquitoes in the genus Aedes, Aedes aegypti and Aedes albopictus. Both of these mosquitoes are small black mosquitoes with white stripes on their legs and body. They are day biters, meaning they bite humans in the daytime compared to other mosquitoes in the night, and they lay eggs in cool, clean, clear standing water. Anywhere there is rainwater collecting will be a good breeding site for these mosquitoes. These mosquitoes transmit the disease in a typical way. Initially, when they take a blood meal from an infected human, the virus enters the mosquito gut and replicates. Later, within about a week, the virus enters the salivary glands of the mosquito. When the mosquito bites a healthy individual, the virus enters the human's bloodstream and replicates there, causing viremia, and the human succumbs to dengue virus infection. The dengue virus is a small flavivirus, which is an RNA virus. There are 4 serotypes with no cross immunity, which means even if a person has got dengue virus infection previously, they can still get another infection with a different serotype. This virus causes damage to the capillary endothelium, which causes increased capillary permeability and fragility, which leads to plasma leakage. This can cause hemoconcentration if only the plasma is leaked, or it can cause bleeding if capillary fragility is increased, both of which will lead to reduced intravascular volume and shock. The virus also has a direct effect on the bone marrow, which will lead to leukopenia and thrombocytopenia. So, this process can lead to several different kinds of dengue fever, as you can see here. The fever can be asymptomatic, and it has been found that the majority of infections go unnoticed. Those who do get symptoms can have 4 types of the fever. There's the undifferentiated fever, which is like any other viral illness. Then there is dengue fever, which can be with bleeding or without bleeding. The important thing is that dengue fever does not have plasma leakage. In comparison, dengue hemorrhagic fever has evidence of plasma leakage, and it can present without shock or with dengue shock syndrome. Then there is the expanded dengue shock syndrome group, which entails atypical presentations. So, as I said before, the undifferentiated type is like any other viral infection. You get fever and you may get some constitutional symptoms, but eventually it resolves on its own without any persisting abnormalities or complications. Dengue fever is characterized by an episode of high fever lasting for 2 to 7 days. You may have other constitutional symptoms like headache, retroorbital pain, myalgia, arthralgia, or viral exanthem. Apart from that, dengue fever can have hemorrhagic manifestations like petechiae or a positive tourniquet test. A tourniquet test is carried out by inflating a blood pressure cuff on the arm to a value between the patient's systolic and diastolic values and leaving it on for 5 minutes. Then we remove the cuff and wait another couple of minutes and count the petechiae in an area of 1 square inch in the antecubital fossa, as you can see here. More than 10 is significant. Also, another criteria to be fulfilled is that no plasma leakage is present. Dengue hemorrhagic fever is similar, but with the addition of two other criteria, which are thrombocytopenia less than 100,000 and objective evidence of leaky capillaries, that is, ultrasound evidence of fluid in the hepatorenal pouch or the abdomen. Hemorrhagic manifestations are not essential to diagnose hemorrhagic fever if there is evidence of plasma leakage, so the name of the condition itself is a misnomer. Then finally, we have expanded dengue syndrome, which can present with encephalopathy or other isolated organ involvement. To understand the implications of the disease and how to manage the condition, we have to have an idea about the natural course of the disease. Dengue fever has three phases: the febrile phase, critical phase, and convalescent phase. The critical phase is only seen in hemorrhagic fever, and most of the dengue infections only have the febrile and convalescent phases. But the most important thing is to diagnose and treat the patients going into critical phase, as most deaths happen in this phase. Most of the events are summarized in this diagram. In the febrile phase, the patient has high fever, and if the intake is not adequate, the patient can have dehydration. The platelets and WBC count begin to drop, and viremia is evident in this phase, so NS1 antigen can be done up to about 4 days of fever. The second phase is the critical phase. Here, the fever starts settling. In some patients, a second peak of temperature can occur. Here, the patient will have evidence of leaking, and the patient may have bleeding or shock, and meticulous fluid therapy is necessary, which we will be talking about in upcoming videos. The platelets start further dropping below 100,000, and hematocrit starts rising due to the hemoconcentration by plasma leakage. It's important to note that the WBC levels start increasing in this phase. The viremia has subsided, and now dengue IgM increases. The critical phase lasts for 48 hours. Then the recovery phase or convalescent phase occurs. The temperature has normalized, and there is fluid reabsorption intravascularly again. The platelet counts start rising, and the hematocrit normalizes, or may even be a bit low due to the reabsorption of fluid. Dengue IgM and IgG steadily increases. It's important to know the features that are seen in the recovery phase to confirm whether the patient is out of danger or not. The patient will have improved appetite and general well-being. There can also be a convalescent rash, which is typically seen as white patches in a background of red. They can have generalized itching, which is a process of recovery. There is hemodynamic stability, and bradycardia can occur in some. The patient will also have polyuria and diuresis because of fluid reabsorption and elimination. The hematocrit will stabilize, as I said before, and the WBC and platelets will rise. So, that's the introduction to dengue fever. In our next two videos, we will be considering how to manage patients in the febrile phase and critical phase. These videos are of utmost importance for everyone who is working in a ward setting because dengue is a self-resolving condition, and all we can do is manage the fluid status in the body. If it is not properly done, dengue can be deadly. So stay tuned for part 2 and 3 of this video. Thanks for watching!